Today we will continue with another manifestation that is called as enteric fever. Now, I think enteric fever has already been taught you in lecture class. What is enteric fever? My question is, what is enteric fever? Salmonella, typhi, and paratyphi. Anything else? Okay, then why it is called as enteric fever? Okay, there are many infections which may cause diarrhea or dysentery may be associated with fever. Are they included in enteric fever? First thing that you have to understand is why it is called as enteric fever. Suppose an organism enters into the gut through the oral route and gains access into the mucosa of the intestine. Thereafter, it traverses the mucosal barrier and goes into the bloodstream. Now, if the organism is have certain virulent factor by which it can traverse through the normal mucosal membrane of the intestines and then cause primary bacteremia, then we will consider them as systemic illness. Okay. Suppose if there is an intestinal ulcer or mucosal degradation, any organism present in the mucosa may gain access into the bloodstream. But that doesn't comes in the domain of enteric fever. By the term enteric fever, we mean organisms which has a natural route of infection through oral route. From oral route, it enters into the intestine, any part of the intestine, maybe the small intestine or the large intestine. Thereafter, because it has certain virulence factor, it will traverse through the intact or normal mucous membrane into the bloodstream, causing bacteremia. Among the various organisms which cause enteric fever, the important organisms are include will be Salmonella. Other important organism will be Yersinia. Why we deal with Salmonella more? Because Salmonella infections are more common. Okay. Among the Salmonella, we have various types of Salmonella, predominantly into the subspecies of Salmonella enterica. Among them, we have certain organisms like Salmonella enterica typhi or paratyphi, and among paratyphi, we have A, B, and C. All follows the same pattern of infection and pathogenesis. All right. Initially, this fever resembles that symptoms caused by another disease entity called as typhus fever. Okay, so clinically it would resemble that of typhus fever. However, the causative organism was different, hence it was called as typhoid. That means like typhus. Understood? Hence it was called as typhi. Later on, some other salmonella were also identified which caused almost similar illness. They were again classified into paratyphi, subsequently divided into A, B, and C. They are also called as paratyphoidal fever. Have you understood? So when we say the term enteric fever, it is an umbrella terminology. When I say it's a typhoidal fever, that means it is caused by Salmonella typhi. When I say it's a paratyphoidal fever, that means it is caused by Salmonella paratyphi. Have you understood? So this is the overall concept of enteric fever. Now when we say this organism will cause primary bacteremia, that means the pathogenesis lies in primary infection of the bloodstream. And when we say bloodstream, the most common system affected will be the reticuloendothelial system, which would include what are the parts of the reticuloendothelial system? Spleen and liver and no, gallbladder does not come in the reticuloendothelial system. Anything else? Lymph nodes and most importantly bone marrow. Okay. So let us look at further. First, let us look at the classification. I think you are all acquainted with this. Salmonella comes under the Enterobacteriaceae. And among Enterobacteriaceae, it was first identified by Salmon and Smith, hence named after them Salmonella. Later on, Abarth and Gaffey also identified Salmonella typhi, also called as Abarth and Gaffey bacilli, initially named as Abartha typhi, later on called as Salmonella typhi. Now look at this. So salmonellosis, that means infection caused by salmonella. It may cause enteric fever or it may cause localized infections. Now localized infections means, what is the localized infection over here? It is the infection of the intestine. Those are separately called as non-typhoidal salmonella. Okay. Generally, these are commonly associated with intestinal infections, but sometimes they may also cause bacteria. Overall, today we will look more into the two types, that is the typhi, typhoid fever, and paratyphi, which causes paratyphoid fever. Now this, look at this chart, this is called as Kaufman-White classification. Now what is the basis of this classification is, how can we differentiate between the various types of salmonella. This classification over here, look, this is the serogroup. Serogroup means, any idea? When we test for the antibodies, some types of salmonella will react, some won't. So different types of serogroups are classified over here. Now this is the serotype name, and these are the various antigens present. What is the O antigen? Somatic antigen. What is H antigen? Flagellar. What is VI antigen? No. What is capsular antigen? So basically, like any other bacilli, what salmonella will have. So suppose this is the bacilli, it will have flagella. So this will be the H antigen. The body will have the O antigen, and sometimes it may have an envelope. This will be the VI antigen. Now, based on this, we have classified this one. So, if we start, suppose there is a patient who is suspected of having enteric fever. We have taken the blood sample, and from the blood, we have cultured an organism. Now we have identified this is salmonella. Now we need to identify which is salmonella typhi, paratyphi A or B or C. How will we proceed? We will proceed by reacting that salmonella with antiserum. So that particular strain will react with some particular antiserum. For paratyphi, it will react with 1, 2 and 12 for O antigen. So if we take the O antiserum, it will react with 1, 2 and 12. So we sequentially test, and if it comes positive for 9 and 12 for O antigen, we will call it as Salmonella typhi. This is the basis of the classification. You don't need to memorize this. Just try to understand why it is being done for identification. Okay. Now, among Salmonella, we have two species. One is Enterica and another is Bongo. Among the Enterica, we have many subspecies like Enterica, Salame. They cause infections in various types of animals, including vertebrates and non-vertebrates. But we must focus on the type of Salmonella which cause human infections. Among the human infections, we have Salmonella typhi, which belongs to subspecies, species Enterica, subspecies Enterica. And when we say typhi, that means it's a serotype. Remember the Kaufman-White classification? So it will be serotype typhi. So in your examination, if you are asked to write the name of the organism, you must write properly in this manner: Salmonella, Enterica, subspecies Enterica, then serotype typhi. One more important thing you should remember: because it's serotype, the T is capital. If it was paratyphi, the P would have been capital. Okay. Normally in scientific, while writing the scientific name, we write in small species. But over here it is serotype, not subspecies. So next time in your examination, whether Viva or anywhere, if you do specify Salmonella typhi, always try to say it properly. Salmonella enterica, that is the species, subspecies will be enterica, and then serotype typhi or paratyphi A, B, C. Okay. Now you have already told these are the antigens: the O antigen, the H antigen, and the VI or the capsular antigen that is found in some species, not in all species. Rest are, so I think you already know about the differences between the H and O antigen. You can go through it. I'm not talking about this one right now. Now, as far as the VI antigen is concerned, it is expressed in few serotypes like typhi, paratyphi, and some non-salmonella also. So there is cross reactivity. I'll come to the importance later on. Now, why it is not so significant yet significant? That means it is poorly immunogenic because it is not present in all strain. It does not produce antibody. However, when there is complete absence of VI antibody, that means the body is not able to respond. So that means if VI antibody is present, that means body is reacting against the bacilli. So the chances of the body clearing the bacilli is higher. And if it is absent, that means there is a higher chance that the bacilli will be retained within the body. What do we call that? Suppose a patient gets infected, we treat them, but the body is not able to eliminate all bacteria. They become carrier. So they disappear in the early convalescence. Early convalescence means when the patient is getting well. And thereafter it persists. If it persists, why it should persist? Because the bacilli must be retained somewhere in the body, in the reticuloendothelial system, so that there is a chronic stimulation. Hence, after the patient gets better, if we detect antibody to VI, that means the patient has become carrier. So this is the importance of detection of carrier. Another importance is this can be used also as a vaccine, because if we do vaccinate an individual with this antigen, the body will be able to mount a proper reaction against the bacilli. Hence, it can be cleared much easily. Okay. Now let us look at the typhoidal salmonella. Typhoidal means it will include typhoid, that is caused by Salmonella typhi, and the paratyphoid, that is paratyphi A, B, and C. Transmission, I think you already know, by the fecal route. The infective dose is around 10^3, 10^6. And now, who are more predisposed? For salmonellosis, who will be more predisposed? As far as typhi is concerned, the reservoir is human beings. So it is the fecal route of contamination. Gastric acidity produces some protection. People on antacid therapy will be more prone. People who have decreased immune status will be more prone. Small children and elderly will be more prone. But most importantly, people who do consume food or water from suspected or unhygienic condition will be more prone, especially in areas where there is excessive overcrowding with poor sanitation facilities. Okay. The pathogenesis, I think you already know how the pathogenesis occurs. There is a localized infection of the intestinal mucosa. From the intestinal mucosa, it will traverse from the intestine into the bloodstream, and it will cause primary bacteria. The primary bacteria will lead to the manifestation by signs and symptoms. What will be the manifestations? First is there will be fever. Now, why it is stepladder? What do you mean by stepladder? Uthai. When we plot the daily temperature of the patient, we will observe that the patient will have rising temperature every day. When the temperature reduces, it will not come back to the temperature of the previous day. নিচে নামবে না, একটা level of the নামবে আবার উঠবে. So when we chart it for a prolonged period of time, it will appear like steps which goes on increasing. Okay, then after primary bacteremia, it will spread to the endothelial, reticuloendothelial tissues including liver, spleen, lymph node and bone marrow, from where there will be further multiplication. This is the reason why we have the manifestation of increasing fever as the disease progresses. If it is still untreated, what will happen? Then it will seed to other organs. So incubation period is about 10 to 14 days. Fever along with other symptoms like chills, sweats, myalgia, vomiting. Rashes can also be seen like rose spots, but they are generally seen in light complexion people. In dark complexion, people with dark complexion, you may miss the rose spot easily. Other manifestations would include abdominal pain, nausea, vomiting, and sometimes you can have an elicited history of diarrhea in the initial period followed by constipation. Other important signs would be hepatosplenomegaly, epistaxis, and very importantly is relative bradycardia. What is relative bradycardia? Any idea? What is relative bradycardia? So if a patient is having fever, what do we normally expect? There will be rising heart rate. Fever is caused by the pyrogens that are released from the organisms. And if there is an inflammatory process going on, what will happen? It will speed up the heart rate. So normally it is seen for every degree of rise of temperature in centigrade, heart rate raises to about 10 to 15 beats per minute. Okay. Suppose a patient has a normal heart rate of about say 90 beats per minute. Now he has a temperature of say 38 degrees centigrade. So we will be expecting the heart rate to be somewhere around 100, more than 100. But over here we find that the heart rate is not increased. It may increase from 90 to 95, but it will not increase the expected amount. That is called as relative bradycardia. But don't think that in enteric fever you will be getting bradycardia. No, you will not have bradycardia. You may find tachycardia, but what you will find is a relative bradycardia. Other manifestations like gastrointestinal bleeding or intestinal perforation, this can occur if the patient is untreated. The site where the initial infection occurs, in the mucosal membrane, there will be ulceration. Because of the ulceration, there might be intestinal bleeding, and if the ulcer becomes larger, more the depth increases, it can also lead to intestinal perforation. And the last part, if the patient is still not treated, this manifestation was actually seen in the pre-antibiotic era. Some of the patient would end up into a delirious state that would resemble that of typhus fever. Even in typhus fever, untreated conditions, the patient would enter into a delirious state, delirium. That is, the consciousness would be clouded. So, in the late stages of typhoid fever, untreated patients will also enter into a delirious state. Hence, it was called as typhoidal, that means like typhus. Okay, humans are the only natural host. Now, coming to the incidence, the Southeast Asia region, especially in Pakistan, India, Bangladesh, these are endemic for salmonella infection. Hence, we should be aware of this. Okay, these I think you know. Now, coming to which type of infection is more common, typhi is more common than paratyphi, and among paratyphi, most common is paratyphi A. Rarely or uncommonly, we see paratyphi B infection. Infections with paratyphi C is not seen in India. This is the reason why, if you take any report from, say, a commonly done serological test is called as Widal test. When you look at the Widal test, you will find we are testing only for typhi, paratyphi A and B. C is generally not tested because it is not seen in India. Now, this is a very important. When I say that these human beings are the only reservoir, that means if we do not have the cases, the infection should have subsided, right? But this does not happen. Why? Because a large percentage of patients who get infected will end up being carriers. And these carriers will slowly transmit the organism from the urine and fecal matter, thereby contaminating other water or food sources. I think you are already acquainted with the story called as Typhoid Mary. Well, she was a chef and she was once infected with salmonellosis and then she became a carrier, and it is suspected that she had infected a large number of people because she was a carrier. Now, what type of carriers is generally seen? Either fecal carrier or urinary carrier. Now, when I say fecal or urinary carrier, how does the organism end up in the feces or in the urine? Any idea? डिजीज हो गया, प्राइमरी बैक्टीरिया हो गया, सेकेंडरी बैक्टीरिया, पेशेंट सर्वाइव, अब ऑर्गेनिज्म कहाँ रहेगा? नो, गट में रहेगा तो मैनिफेस्टेड होगा ना, गट से तो इन्फेक्शन शुरू होगा, प्राइमरी बैक्टीरिया हुआ, ऑर्गन में गया, सीड किया ऑल ओवर बॉडी, फिर सेकेंडरी बैक्टीरिया हुआ, क्लिनिकली मैनिफेस्ट किया, then you have treated. Suppose the treatment was not complete and the patient ended up being a carrier, तो ऑर्गेनिज्म कहाँ रहेंगे? Exactly, it will remain in the reticuloendothelial system. From reticuloendothelial system, it will seed. Sometimes it will seed into the bloodstream, and from there to the kidneys, and from kidneys to the urine, or from liver, the bile will end up in the intestine, and from intestine to the fecal matter. That is the route of spreading of the organism by the carriers. So the carrier again can be divided into two types. One is called as the temporary carrier, one is called as the chronic carrier. Now, can you explain why some people become temporary, some become chronic? Exactly. If the body is not able to clear the organism totally, they will end up being a permanent carrier. But if the body is still reacting and is fighting with us, that is the period we call it as temporary carrier. That is the only difference. So we need to test these patients again and again. If the patients are still shedding the organism beyond 3 months, that means the patient is not able to clear the organism and will end up being a permanent carrier. Okay. Chronic carriers are more seen in, see, this is very easily explained in infants and old age because of the low immune system. Now it is commonly seen more commonly in women. So that's just a statistical part. Now, biliary tract abnormalities lead to increased fecal excreta. Why? Because from liver, the bile comes from the liver, it is stored in the gallbladder. And then when people start eating, the bile is discharged from gallbladder into the duodenum. This is the normal route. If there is any abnormal, for example, a cholecystectomy is done, or there is, say, cholelithiasis, that is gallbladder stones. So it forms a nidus where an organism can survive. Gallbladder के अंदर तो blood supply है नहीं, right? So if the salmonella reaches inside the gallbladder, it will remain protected over there. It may not multiply in such an amount to cause the disease, but it will survive over there. थोड़ा थोड़ा replicate करेगा, long time survive करेगा, and slowly and steadily it will shed. That is how carriers work. Now let us come to the diagnosis. For diagnosis, what is the first important part you should understand is you have to take the detailed history of the patient. Okay. What are the important history that you should take in a patient who is suspected of enteric fever? Very good. First is the patient will come with a complaint of fever. Fine. You will have to take a detailed history of fever. What was the initial symptom? When the fever started? What was the type of the fever? Then हो गया fever का duration and okay, gastrointestinal history. Anything else? Okay, rashes on the body. Anything else? আর কি কি history নেবে? Social history, coming in contact. What is the food history? Travel history, very important. For example, Varanasi is an endemic area for salmonellosis. We have to inquire whether he has traveled in any sort of endemic area or not. Travel history is very important. Occupational history, where does the patient is occupied? Maybe he is working in a corporate, but he is eating in the lunchtime where um, like a roadside dhaba or something like that. We have to take that history also. Then you have to test. The best way of laboratory diagnosis is to get the confirmatory diagnosis. Over here, the confirmatory diagnosis is to diagnose the organism. Now, what would be the sample for which we can take for diagnosis? That will depend on the duration of illness. That is why detailed history is important. Please try to recall the pathogenesis. The symptoms will start after the primary bacteremia. So, during the primary bacteremia itself, the first symptom would be fever, right? After the secondary bacteremia, it will be prolonged fever. Thereafter, other manifestations will come. Now, look at this chart. In the first week, the best sample would be to take is a blood culture or bone marrow or duodenal aspirate. Why blood culture? Because we are trying to detect primary or secondary bacteremia. Why bone marrow? Because it is a part of the reticuloendothelial system. After the primary bacteremia, the organism will end up in the reticuloendothelial system. Other organs would be liver or spleen. But if you go and take a liver aspirate or a spleen aspirate, it will be very risky. Right? So the better alternative would be bone marrow. And why duodenal aspirate? Because initial infection was in the intestine. So any kind of aspirate may also provide you with the organism. That is in the first week of illness. But suppose the patient comes to you at the second week of illness, the probability of getting a blood culture goes down. Because now the organism has already seeded into secondary organs. If you go and take repeated blood culture, even then the probability of getting the organism goes down very. So for the second to third week, the best modality of diagnosis would be serological modality. That means because the 1 week has already passed, so the patient will not start producing antibodies. So if we test for antibodies during the second week, we can detect. If the patient comes in the third or fourth week, which is very rare, at that point of time, the organism has already seeded into the liver or the bone marrow or the spleens. So now the organism will start shedding. The patient will start shedding the organism through the urinary or the fecal. So now, if we have to detect, we have to test urine or stool. Now, this is the same logic that we have to apply while detecting carriers. Conventional blood culture system or automated blood culture system can be done. Now, for stool culture, these are important. I'll just highlight the important points. Okay. It is generally done 3 to 4 weeks after the illness starts. We have to put the stool or urine in what is called as enrichment broth. What is enrichment broth? What is enriched media and what is enrichment broth? Broth means liquid. See, media can be solid media or liquid media. If you put agar in it will become solid media. If you don't put it, it will become broth. asking you what is enriched media and what is enrichment. That is new. That is enriched media. That becomes selective media. Now, this is a very common question that may be asked to you by the how. What is the principle? There is enriched media, there is enrichment media, and there is selective media. What are the difference between these three? First is enriched media. To any basal media, if we put a highly nutritious substance, a blood or serum, etc., we call it as enriched media. This will allow the growth of both fastidious and non-fastidious. Fastidious means organisms which have specific nutritional requirement. Understood? That is enriched media. Now, suppose we add particular substance that can be tolerated by a particular organism but not by others. Then it becomes selective media. For example, let us say I have an organism which can tolerate high concentration of salt, and to the same basal media I put high concentration of salt. What will happen? All other organisms cannot survive, only that specific organism will survive. Recall what is that Venkatraman Ramakrishnan medium. It is autoclaved seawater. Vibrio cholerae can survive because it can survive at a high concentration of salt. Other organisms cannot survive. That becomes a selective media. Enrichment media will provide additional growth factors for some organisms, but it will not inhibit the growth of other organisms. Have you understood? Now, that means this selenite F broth, the tetrafan broth, it will enhance the growth of salmonella. Other organisms will survive. They may not multiply as rapidly, but they will survive. Our objective over here is to let this organism multiply. Why? The question is why? Answer is very simple. If you take the fecal matter of any person, you will have numerous number of bacteria. Numerous. And salmonella among them will be very small in number. So even if you take a large fecal matter, probability of yielding salmonella will be very less. Hence, we need to use this enrichment probe. They will enhance the replication of salmonella. So the probability of getting the salmonella from stool sample increases. Have you understood now? Fine. And also we use highly selective media. Selective means these media would not allow the growth of other organisms. It will only allow the growth of salmonella. This would include DCA, XLD and Wilson Blair media. Okay. But we don't need to use enrichment broth technique for urine. Why? Because generally urine should not have any other organisms. Understood? So this is mainly for the stool sample. So these are the some pictures like in the DCA, the salmonella will produce H2S, hence it will produce black colored colonies. And on XLD, we can see red color colonies with black center because of production of H2S. Hence, we can detect them easily. Other specimen I have already told you, a bone marrow aspirate or a duodenal aspirate can be taken in the first week. After getting the culture, we need to test for the biochemical, and this you already know. And after that, we have to test for the serotype with the anti-sera. I have already described the Kaufman-White classification. Based on the type of the anti-sera, now we can identify whether it's a Salmonella typhi or paratyphi A, B or C. Thereafter, we also need to go for the antimicrobial susceptibility testing. Why? There is an empirical therapy, but because India is endemic for Salmonella infection, there is also increasing number of cases of multi-drug resistant Salmonella also. That is the reason why you should also get an antimicrobial susceptibility test done. Now coming to serological testing. This was all about culture in the first week or in the third or the fourth week. In the second week, the best method of diagnosis is by serological test. In serological test, we can do what is known as Hovidal test. It's a what type of test this is? Serological. What kind of test is this? Dilution test. What type of antigen antibody reaction is this? What type of test are this? Precipitation, agglutination, agglutination. Sure. Or precipitation. Okay. Okay. So the interpretations are very simple. Normally in India we have a baseline titer, that is any result in which it comes as less than equal to 1:80 dilution, we do not take it as positive. Anything above that, that is more than equal to 1 by 160, is considered to be as positive. Now we test only for the O antigen and the H antigen. O means somatic, H is the flagellar antigen. Now if TO, that is shared by all three, that is typhi and paratyphi. If TO comes positive, now among the O antigen antibodies against O and H antigen, O antigen will appear first, H antigen will appear delayed, and it will remain for a longer time. Now when we are testing, if the O comes positive, then we also need to test for the H antigen, for T for typhi, A for paratyphi A, and B for paratyphi B. So if TO and TH comes positive, that means typhi. If TO and AH comes positive, paratyphi A. And if TO and BH comes positive, paratyphi B, in case of acute infection. Now here comes the various permutations and combinations. Now if a patient has, say, TO more than 1 by 160, none of the H antigens comes positive. What does it mean? Acute. Fine. If suppose this comes as equal to 1:80, however, TH comes more than 1:320. That is not called chronic. This is also, you cannot say properly. That is what I want to make you understand. So a single viral report is very difficult to interpret. समझे कि नहीं? Have you understood? See, the antibody titers will rise up and then go down. If you take a single test, you are taking only a snapshot. So from one snapshot, can you say what is happening? No. So you need at least 2 tests to be done. And for the change to happen, it must be tested at least 5 to 7 days after the first test. For example, say if this was the test result in the first time you have tested, TO is equal to 1:160, and none of the H antigen gave a reactive, non-reactive. After 5 days, TO now is, say, equal to 1:320, and TH is equal to, say, 1:160. What does this mean? That means this is an acute infection by Salmonella typhi. Now we can say, if we had only this result, we could not say anything. It could be a convalescent phase, it could be treated, untreated, anything could happen. That means for proper interpretation, you have to test twice, at least 5 to 7 days after the first test. So this is the problem with the serological test. So when the patient comes to you, you advise for the Widal test. The patient goes to the laboratory, get the test done, and one day after again comes to you. You cannot provide exact diagnosis. There is another test that is called as typhi test. In that test, what is done is specific antigen are used to detect IgG and IgM. If IgM comes positive, that means it's an acute typhoidal fever, maybe typhoidal, maybe paratyphoid, whatever it may be, based on the antigen used, it's an acute infection. However, if only IgG comes positive, you cannot say whether the patient is infected or not, because IgG may stay positive for up to 2 years. There lies the problem with the typhi test. Other methods, like even molecular methods like a nucleic acid amplification test, can also be used. However, still today, Widal test remains very much useful. Although it's a very old test, more than the 150 years. Now, there are two types of, just look at this picture. Okay. This is the O antigen that is tested, and this is the H antigen here tested. And after agglutination, you can see this is a more organized type of agglutination, and what this is more spread out. So this has been described like the O antigen chalky clumps, and this is like woolly clumps. Those are the words that have been used to describe. I think you can get a visual representation. O have more densely packed, whereas the H antigen is more sparsely spread out. So the tube Widal test or the tube agglutination test is done with, as the name suggests, with the help of test tubes. There are two types of test tubes where Felix test tubes are used. Now, can you describe what are these? What do you mean by titer? What is dilution and what is titer? Titer ki or dilution ki? If we take the serum undiluted and we test, it comes positive. The level of antibodies may be very high or very low. So, to get the exact quantification of the antibodies, we need to estimate the titer, that is the level of antibodies or the amount of antibodies present in the serum. To get that, we need to dilute. Why? Because try to recall antigen antibody reactions. Antigen and antibody reaction occurs at the zone of equivalence. মনে পড়ছে কিছু? Say we have taken 3 test tubes. In one test tube we have 100 antigen, 1 antibody. Over here we have 1 antigen, 100 antibody. And over here we have 10 antigen and we have 10 antibody. After letting to react, what will happen? There will be one positive antigen antibody complex in both these two, whereas there are 10 antigen antibody complexes, right? So visually positive result will be seen in which tube? In the central tube, because there is a equal number of antigen or antibody. If either one is present in excess, we cannot observe the reaction. Have you understood? So this will be called as, where there is antigen excess is called as antibody excess, will be called as the কি বলতে পারে না পুরো ইমিউনোলজি পড়ানো হয়ে গেছে. Now try to understand, if the patient is having the disease in the second week, will produce huge number of antibodies. If the antibodies are huge in quantity, the reaction will go negative. So we need to dilute the patient sera. Why? The sera will have antibody, so we need to dilute. How to dilute? It is called as serial dilution. How to do serial dilution? For example, say there is a series of test tubes. In the first test tube, there is undiluted syrup, and on this test tube, say I have taken 9 ml of normal saline and I have put 1 ml of syrup. So, what will be the concentration of antibody in this one? It will be total koto 10. 1 plus 9, 10. So, concentration will be 1:10. Understood? If we go and do this every time with 1:10 dilution, next tube will be 1:100. Next will be 1:1000. This is called as serial dilution. We can also do it in such a way, after having diluted in 10, we can go for double dilution. Double dilution means now I have taken 5 ml of normal saline and I have added 5 ml of 1:10. Now what will be the concentration? This is 5 ml out of 10 or 1:2. Initially কত ছিল 1:10, 1:10 কে 1:2 করেছি, তাহলে এক্স্যাক্টলি কত হবে? দিস উইল বি 1:20। আবার ডাবল ডাইলুশন করলে কত হবে? 1:40, তারপর 1:80, 1:160, 320, তারপরে you can go on 1:640 and furthermore. This is how dilution is done. বোঝা গেছে? Now look at this picture. This is the control, saline control. Saline control means it will only have antigen, no antibody. That means no serum. Now we have diluted the patient serum from here to here. Look over here. The reaction comes positive here, also positive over here, also positive over here, also positive, but here it is negative. That means the amount of antibodies present is at least 1:160. So the titer koto hobe? More than equal to 1/160, because the reaction come positive after dilution by 1:160. এটাই দেখবে কিছু কিছু রিপোর্টে লেখা থাকে it comes at 1/160 dils. Dils means dilution, or 1:160. This is the titer. This is not exact quantification, this is semi-quantitative estimation. Similarly, look at this one. At a negative, this will be 1:3. In India, we take a positive value more than equal to 1/160. Okay? Because India is endemic, many a times we get infected but we do not get the disease, or we may have a past history of disease. For that, in India, we take 1:160. Okay. So, charta to devai ache. I think you can understand. Rise of TO and TH, that means enteric fever due to typhi. TOH, paratyphi, TOBH, paratyphi B. These are simple. Now, only TO. This is because of early infective phase by any cell. Only TH, it may be treated or amnestic. That means the patient is not able to mount a proper serological reaction, or the patient is undergoing treatment. That means in the convalescent phase. Rise of all titer, but only in the H, not in the O. That will indicate vaccination. Okay? So before saying this patient is vaccinated, look at three things. First is the titers of all flagellal antigens. TH, AH, BH will be same, but there will be no T. তোমাদের অস্পির পরীক্ষায় এরকম একটা চার্ট দেওয়া হবে। You have to include. If you have understood this chart, you can answer. In examination, anything can be given. Acute phase, or a convalescent phase, or a typhi, paratyphi A or B. infection or a vaccination phase. আরে বইয়ে সব আছে, অত ফটো তোলার দরকার নেই, সব বইয়ে আছে। বই পড়বে না, শুধু হচ্ছে নোটবুক পড়বে। টেক্সট বই কিনেছ? তোমাদের থিওরি খাতা দেখে তো মনে হয় না যে তোমরা টেক্সট বই পড়ে লিখছো, সব তো এই কোচিং এর নোট অ্যান্সার। থিওরির অবস্থা তোমাদের খুব খারাপ, খুবই খারাপ। দেখ, there are various important things like false positive test. What is false positive? That means the reaction is positive, however the patient is not diseased. It can happen in certain conditions like in amnestic response. What is amnestic response? What is amnestic response? Cannot harm. Why? This usually happens because body have some immunological memory. So when a new pathogen infects the body will raise all the antibodies it had a previous exposure. So all antibodies will rise initially. Thereafter, if the body then recognizes a similar pathogen, only that antibody will go on rising, others will come down. So in the early initial phase, we can find rising of antibody titer against all previously exposed pathogens. This is called as amnestic response. The second would be if the test is not done well properly, or if the patient is already vaccinated. I have already told you what will be the interpretation in vaccination. Okay. False negative, that means the patient is diseased, but the without test gives you a negative result. This can happen either in the early phase, the first week, or after the fourth week. In carriers, organism is there, but disease is not there, or the patient is not able to mount an immunological response. This can happen again if the patient is on antibiotics, or because of the prozone phenomenon. Prozone phenomenon means antibody excess. Suppose the patient has huge number of antibodies and you haven't proceeded for the dilutions. What will happen? The reaction will come negative. That is why dilution is very important. O agglutinin appears early, disappears early. O are non-specific. I have already told you all these things. Other tests would include the typhoid test, ELISA test, or dot blot assays, or we can also use the nucleic acid amplification test like PCR. Other tests that we normally do would include other parameters like the whole blood cell count, liver enzymes, etc. etc. Now, for detection of carriers, I have already told you we can go for the stool culture, or we can use for detection of VI antigen. If the VI antigen titer are more than 1:10, then we can consider this patient is having the carrier state, because normally after the disease the antibody titer should go down. If even after a prolonged period of time the antibodies are raised, that means the organism is somewhere in the body and is still expressing, hence the antibody titers are still high. So if the antibody titer is more than 1:10, that is significant, but it has to be corroborated with culture, urinary or stool culture. Other methods of detection, that is the epidemiological studies. I think this you will read in PSM for the community survey. The sewage testing can be done. I am not going into details of all these things. Okay. So the common treatment at present is using ceftriaxone along with azithromycin. However, testing should be done because of increasing reports of multi-drug resistant salmonella. For the carriers, we have to use ampicillin or amoxicillin along with probenecid. What is probenecid? কেন দেওয়া হয়? What is the excretion of ampicillin? Antibiotics পড়ানো হয় না? Probenecid delays the excretion. So what are the control measures? The control measures will be control of reservoir. Who are the reservoir? The cases and the carriers. A very important part of the carrier is people who have the organism in their blood. So cholecystectomy is also recommended for people who even after antibiotic therapy do not respond. So we need to control the reservoir. Then sanitation measure, obviously we have to stop the chain of transmission from patients to other people through the fecal route. That can be controlled only with sanitary measures. And vaccines. Okay. Coming to vaccines, there is one called as a polysaccharide VI vaccine. VI means the capsule. Why this can be used for vaccine? It will mount an immunological response, hence the patient can clear the organism in the primary bacterial phase itself. However, you have to give it booster every 2 years because immunological memory is very poor. সেই জন্যই থাকেন। Okay. The another is the VI EPA vaccine. This is a recombinant vaccine using Pseudomonas aeruginosa. Advantage is this can be given for children less than 2 years. Why it has been developed? Because the VI polysaccharide vaccine cannot be given to children less than 2 years. Recall, initially I've already told you infants are very much infants and children less than 2 years vulnerable for infections. Another vaccine is typhoid vaccine. This, as the name suggests, is an oral vaccine. This is a live attenuated vaccine against Salmonella typhi strain TY2A. Now, because it lacks this enzyme, it cannot cause the disease. However, it's a live, so it cannot be given to people who are immune compromised. Okay, it is indicated only after 6 years of age. Now, oral means through the oral route, it comes in enteric coated tablets. What is enteric coated tablet? Exactly. প্রথমে কি বলেছিলাম, people who have decreased acid production in the stomach are more vulnerable for infection. So if you vaccinate a normal people, you have to protect this live vaccine, that is the live bacteria, from the gastric acid also. Hence this is given in enteric coated capsules. It is given before food. Why not after food? After food HCl increases, খাবার খেলেই তো অ্যাসিড সিক্রেশন বাড়ে। Then it is given in alternative 1, 3 and 5 and 7 with booster every 5 years. Immunity lasts for about 4 years, hence booster is given after 4 years. Now this is important. Protective immunity starts after 7 days and lasts 4 years. Why this is important? Any idea? তোমার জেনে কি লাভ হলো? তোমার কি লাভ হলো? ভাবো আমি পেশেন্ট, আমি তোমার কাছে গেলাম, আমি কেন ভ্যাকসিন নিতে যাব? কি বললাম আগে, কখন স্প্রেড হয়? যখন একটা লার্জ পিপলের গ্যাদারিং হয়। রিসেন্টলি কুম্ভ মেলা হলো, বা সৌদি আরবের লোকে হজ করতে যায়। What happens when large people gathers in a small area? Obviously in that area sanitary measures will not be adequate. That can become an epicenter of spreading of infection. বোঝা গেছে? Suppose next time you come to me and say আমি কুম্ভ মেলা যাবো, আমার বেনারসে হচ্ছে, আমার যাওয়ার ইচ্ছা আছে কিন্তু ভয় লাগে যদি সালমোনেলাইসিস হয়ে যায়। What can I do? You can take a vaccine. Then you will ask me, आज तो वैक्सीन ले लिया, कब जाऊं? कल, परसों, 10 दिन बाद? That's what you have to say. After completion of the total vaccination by 1, 3, 5 and 7, you have to wait for 7 days. Thereafter you will be protected. And the protection will last only 4 years. Why this is important? इस साल का तो हो गया, 4 साल बाद फिर जाऊंगा, तो दोबारा वैक्सीन लेना पड़ेगा। These are the questions you have to answer. That is why you must know this. Okay. There is another called as parental tap vaccine. This is a heat kill vaccine. This can be given even to people who are immune compromised. Okay. Now last part is non-typhoidal salmonellosis. Non-typhoidal salmonellosis means all the salmonella which cause after people get infected through the fecal route. They will go into the intestine and cause localized infection. So the manifestation will be generally diarrhea and dysentery, rarely dysentery, and very rarely it can permeate from the gut into the bloodstream and cause systemic infection. Those are more commonly seen in infants and elderly people with low immunity and people who have valvular heart disease. Why? Because people who have valvular heart disease will have some sort of cardiac defects where the organism can lodge over there. Answer these questions. Infective dose of Salmonella typhi is Konda. B. A, B, C Konda. মনে থাকবে সুভাষ চন্দ্র বসু বাসু blood A for antibody, that is Vidal or typhoid or whatever. In the second week, blood or bone marrow culture. In first week, antibody in the second week, stool and urine in third and fourth week. So the answer over here will be viral. Okay. Okay. Chalo. That was all about enteric fever. Now, as far as the exams concerned, any queries? No query.